We are
Hello viewers, welcome to the Facebook live session. Myself, Dr. Sujatha Vellanki, Fertility Specialist from OSS Fertility, Vijayawada. There is a concept of whether you should do an exercise to improve the male factor infertility or whether doing exercise is going to have an impact on your infertility or the sperm count. So sometimes we do hear conditions where there are excessive exercise or going to the gym or taking supplements for going to the gym. You might experience a low sperm count or sperm issues. Or is it the vice versa? So, in today's live session, let us delve into the topic of male infertility and how exercise is going to have an impact on male infertility. So, as we all know, that lifestyle factors like alcohol consumption, smoking, or even lack of physical activity, all these can trigger fertility issues among the males. So, when it comes to the male factor infertility, we cannot emphasize much on the role of lifestyle factors. So, how do we evaluate the male factor infertility? So, when you're trying to elicit the history, most of the times when I speak to the couple, what happens is they would be experiencing and telling me that they have no history of smoking, no alcohol, we don't have any habits, but still my sperm count is very low and it is not increasing. So, when we take a proper history, we would be able to identify the root cause of what is causing this low sperm count or sperm issues. So, that is why history is very important. Now, with the era of having work from home and the software laid off jobs, so most of the times there is a lot of stress, and the number of work hours usually that you are spending on the desk job or to reach your deliverables is very much more. So gone are the days where you're working from 10 to 4, and now sometimes with the concept of work from home, this work is being carried home, and you end up working for more number of hours than the 10 to 4 or 6 or 8 hours job. You end up taking this even up to 7, 7:38 in the evening. So looking at these deliverables, there will be a lot of stress which is going into the deliverables of your work. Also, there is a lot of physical inactivity because of you being sitting with the computer or with the desktop for hours together trying to complete your work. So, this lack of inactivity is one thing which is going to have an effect on the sperm parameters. So when we look at the examination component, there's not much of changes. Very few people may have these problems of varicocele or the testis is small by birth. Otherwise, generally the testicular examination, genital examination seems to be normal. Some of them might experience lack of sexual desire, lack of interest in sexual intercourse. So if you are experiencing any of those symptoms, you need to visit a doctor at the right time. So the first and foremost thing that you need to look at when you're evaluating whether you might have this problem of male infertility or sperm parameters is to check for the semen analysis. So when you're giving a semen sample, at least 2 to 3 days of abstinence is important. And this sample, we look for the sperm, the volume of the semen, the sperm count that is there, and the sperm motility and morphology. So, coming into the topic, so let us see this picture. This gentleman came to me for a routine semen analysis. He's a very young lad, 27, 28 years, work from home. He feels that there was no stress in the job and there's no problem at all. And however, the job time includes from start. He starts at home at 8 o'clock, reaches starts his work at 8 o'clock at home, and then he completes this work even in the evening at 8 in the night. So when he came to me for the semen analysis, this is how the report was. I can see hardly any sperms, like one or two, hardly only two sperms which are seen, which are motile and very, very slowly moving. So this is the amount of count that we had. And he said, I don't have any habits. I don't smoke. I don't drink. I don't eat outside. I don't even have processed foods or I don't eat any junk food. I only take food at home. But in spite of this, these are the only two sperms that we could see in his semen sample. So when we looked at this gentleman's history more into detail, that is where we came about the problem of like what is the problem that is causing this sperm to have only very less number of sperms. So this came into like the picture of a lack of physical activity. Any physical activity I don't have time. Since I'm already closing my work at 8 in the evening, I would not be having, I would help my wife for a couple of hours, then we go to bed, and by the time I get up in the morning, I have to again get ready for my job. So absolutely no physical activity at all. So when you are looking, when do we say that the sperm analysis or the count is normal? So the volume has to be 1.5 ml. The semen count should be 15 million per ml. Motility should be more than 40% and morphology should be more than 4%. When you don't find these parameters, that is where we should look at whether there is a problem with the sperm production, whether there is a problem with the sperm transport mechanism, or whether there is any problem with the sperm related factors or the factors that are signaling the sperm production from the brain. So here comes the hormonal imbalance. So when you're having a hormonal imbalance, the brain does not produce adequate hormones to help the testes to produce adequate testosterone or the sperm count. That is where you might end up in having a hormonal imbalance. So the main culprit for this hormonal imbalance or disruptions in the sperm production is the lack of physical activity or the sedentary lifestyle. This sedentary lifestyle also leads to obesity, weight gain, which further increases the chances of diabetes, heart disease, and high blood pressure. So this again will have an impact on the physical activity, and again will have an impact on the sperm production. So when these conditions are taken care of with help of physical activity. So now I will just tell you about one study which was done where they were trying to elicit whether just 6 months of frequent exercise will it improve the sperm quality. So this was a study which was done in sedentary men who were not having any physical activity. So they have excluded all the women, all the men who were having said physical activity of at least 3 times in a week for 30 to 40 minutes. Anything below that was taken as sedentary lifestyle. So what they did was these men were divided into the researchers here. This was done in Iran, and they've taken about 261 healthy men between the age of 25 to 40 years. So during this time, when they followed a regular exercise, so like the exercise pattern was divided into four groups. One group had moderate continuous training. The second group had high intensity continuous training. And the third group had high intensity interval training. And there was a fourth group that did not do any exercise at all. So what were the four groups? One was they had moderate intensity of training. So when we say moderate intensity of training, that is like they are going on a treadmill for about half an hour in a day, 3 to 4 times in a week. So that is called as moderate intensity of exercise. So another one was the high intensity continuous training was where they were doing 1 hour of the treadmill every 3 to 4 times. So when you say moderate, it was half an hour. When you say high intensity, it was 1 hour. And when they're doing high intensity interval training, so when you say high intensity interval training, this is a very short 1 minute burst they do. They do an adequate, very aggressive exercise for 1 minute, then take a break again for a minute, and then again do this again for another minute, then repeat it for 15 to 20 minutes. So that is what is called as a high intensity training. So this group of men were asked to do the same pattern of exercise for 24 weeks. So when they've taken this exercise for 24 weeks, they've checked the semen samples before and they've checked the semen samples after 24 weeks. So what happened was that they found that all the exercise groups, whether it is moderate, high intensity, or high intensity interval training where they're doing bursts of exercise, all of them had an improvement in the sperm count compared to the control group, which was not doing exercise. However, after completing the 24-week period, the moderate intensity, that who were doing only half an hour of exercise for 3 to 4 days, they showed the highest improvement compared to the high intensity group of exercise. So the authors concluded that those men who do exercise for just 30 minutes, 3 to 4 times in a day, 3 to 4 times in a week. So 30 minutes, 3 to 4 times in a week, consistently for 24 weeks, there was a 10% increase in semen volume, There was a 12% increase in the semen motility. There was a 15 to 17% increase in the sperm count and the morphology. And the most important thing is there was an overall improvement of 20 to 25%. That is about what if the count was only 5 million, it improved to 100 million, 5 times of what it, 20 times of what it was. So 20% increase in the count was in the overall parameters was what was noted. However, what has to be noted is that this sperm count and concentration, it started to drop back to the pre-training levels after within a week of stopping this exercise. So, and also the count came back to normal within 30 days of stopping the exercise pattern. So this study was very interesting and I wanted to discuss this today in this Facebook live session, because those of you, if you are not doing any physical activity, or if you're having a job where you're having a work from home parameters, or where you find that you don't have enough time to do exercise, just give 30 minutes in a day for yourself, and this 30 minutes of simple walking on a treadmill, or walking around your house, or walking in your hall for 30 minutes for only 3 to 4 days, not the whole week. So your Saturday Sunday you can do, and another one day in the week. If you are able to do this component of exercise, there will be a very much good improvement in the sperm count, motility, and morphology, which can be noted. And this should be a consistent, persistent activity. So you do exercise on Monday, and then you don't do for till Saturday. The component of you having the same consistent results will not be there. So it has to be very much consistent with the parameters in terms of how sincere and how serious that you're going to do. So why is this happening? So let us look into why this regular exercise routine is having more advantages. So there is a what happens when you're exercising is there's an improved blood circulation to all the organs of your body, so including the testes. So the hormones which are produced in your brain are reaching the testes, and there is an increased production of testosterone and the sperm parameters. Also, because of this increased blood circulation, because of the mobility activity, whatever nutrients you're taking, whatever good food or diet or balanced diet you're taking, all these nutrients are able to go and reach to the testes where the production of the sperms is happening. So there is an increase in the hormonal balance. Since all the nutrients are reaching the testes over there, there is a better sperm quality. And because of this physical activity, when you're on the higher side in your weight, your BMI is on the higher side, or you're overweight, the chances of you losing weight are there, and the chances of maintaining weight. Excessive weight increases the temperature at the testes and can cause reduction in the sperm count. So when you are able to maintain your weight, this automatically reflects into improvement of the sperm count. And when you are able to devote 30 minutes of your time in a day for yourself, your stress levels will come down, your sleep pattern will increase. You can sleep adequately for at least 8 hours in a day. Thereby, once the stress is coming down, the cortisol levels come down, and its adverse effect on the sperm count is coming down. So, there are so many benefits of doing an exercise. So, now let me tell you what are the types of exercise that you can do. So, as I've told, it is very simple, half an hour of walking on the treadmill. So what are the other types of exercises that can be done? So you can look at cardio exercises or cardiovascular work exercises, that is the treadmill and the cross trainer. You can look at doing the aerobic exercises. You can look at doing the resistance training or the weights exercises. You can look at doing the pilates or the push-ups and the pull-ups. Swimming is one of the best sort of exercise. If you really have access to swimming, that is one of the best one to improve your sperm quality and quantity. Yoga and meditation for 15 to 20 minutes in a day also will improve the blood circulation, reduce the stress levels, and is going to improve your chances of uh, pregnancy and success rates of your trying to conceive naturally. So, what are the things that you should not do? What type of exercises are harmful? vigorous exercises, extensive exercises, like if you're spending 2 to 3 hours in a day doing bodybuilding, taking supplements, protein, or any other added hormonal supplements which contain testosterone or hormones, these are the ones which are going to have a detrimental effect on the male fertility and your sperm count. There are issues where people have gone into bodybuilding, gymming, and taking supplements and testosterone supplements and coming to me with zero sperm count also there are incidences. So these are the things which you need to stay away if you have not completed your family. Also, excessive cycling, maybe for about 10, 20, 30 kilometers. So these are the distances. If you are going for a long distance cycling, some of you would have a habit of going for a long distance cycling, but please keep it on a hold until you have your baby. So this excessive cycling and the seat paddles, which are very hard, there is a lot of friction and heat which is produced at the place of the testis, so can cause a reduction in the sperm count. So, what are the things that you need to look at? The first and foremost thing is, of course, as you exercise, you're going to lose weight and get better sperm count. Refrain from smoking, alcohol, chemical exposure, pesticides, and emotional stress. And also, you need to look at avoiding excessive gymming and excessive stressing. So, the clear take home message here that I would like to give, the best one is like what you can do is like in this person where I saw only two sperms which were present. After about a 15 days to 1 month, again he came back after a physical exercise and activity. We could see few sperms here in this sample. There were many. In the previous sample, there was only two sperms. Here we can see 1, 2, 3, 4, 5, 6. So there were many sperms there. So it started to improve, though it was not adequate. So this guy, we asked him to continue the physical activity and continue trying naturally, and the wife conceived naturally within 3 months of starting this physical activity. So one thing that needs to be very clear for you over here is in terms of like sedentary lifestyle is very bad for male factor infertility, and it is advisable to include at least a minimum of 30 minutes of physical activity or exercise into your regular daily regimen at least 3 to 4 times in a week. If at all time permits, it has to be consistent. Daily, 30 minutes to 1 hour is most ideal. Simple jogging or simple running, along with push ups and pull ups and pilates to increase the core muscle. So, when you're doing the push ups and pull ups, you're going to increase the strength of your core muscles. So, your chances of performing and sexual interest in having intercourse, your interest in sexual intercourse also increases when you have your core muscle strength, which is improving. So, in this way of physical activity and lifestyle modifications can go a long way in improving your semen parameters. So, my dear friends, if you're watching my video for the first time and if you're on this live session, please follow us for more such inputs on importance of how you can improve the male factor infertility. So if there are any questions related to how to improve your low sperm count or any issues of sperm parameters, I can address them in this chart right away. So we have a question here. How long does it take to see improvements in sperm parameters with regular exercise? Consistent exercise, if you are able to do consistently, regularly, for at least 30 minutes to 1 hour in a day, you can see these results within 3 months. The normal production of sperm and the sperm production to transport outside, it takes around 54 to 60 days. So for the changes to happen, if you are able to give at least 20 to 30 days, and then the sperm production and for the sperm to come out in the ejaculate another 54 to 60 days. So normally you can look at these changes within 3 months. Are there any precautions or guidelines regarding exercise in men undergoing fertility treatments? Whenever you're going for fertility treatments or when you're planning for pregnancies, it is advisable to go for moderate intensity exercises and a sustained period of time and consistently and regularly, rather than going for high intensity, heavy lifting of weights, heavy exercises on your legs. These are the ones which are very harmful. And your cycling or cross training for a prolonged period or excessive aerobics in terms of Zumba for prolonged period can produce any of these things which can produce heat near the testis, can be detrimental to the sperm health and thereby might delay your pregnancies. Are there any specific fertility focused exercise programs or recommendations available for men? Yes. The first and foremost thing that you can look at is yoga and meditation for 15 to 20 minutes in a day, followed by doing a minimum of exercises in terms of like where you can look at doing this, what we say, like focusing on balance and stability exercises, which we can look at practicing all the standing poses and the balancing poses, and some gentle stretching exercises will help you in going a long way. The advantage of doing a gentle stretching exercises and the balancing exercises are going to improve the blood circulation to the testicular area and thereby improve the sperm health. So, how do we check for whether there is a problem with male fertility? The first and foremost thing is whenever you plan your marriage, I should say, and when you're thinking of postponing your pregnancies for a year or two, the best thing is, I say, even premarital also. It is always better to check with a fertility specialist and get your basic semen analysis. One simple test in the male can give you the parameters of whether you're having any issues, of whether your routine lifestyle or daily activities or lifestyle changes is having an impact on your reproductive health. So, a simple test is to go for a semen analysis after 2 to 3 days of abstinence. So, once you're clear with the semen analysis report and the sperm count, motility, and morphology is very good, then it should be okay if you're planning to delay your fertility by a year or so. However, if you find that there is any changes in your semen parameters, it is always advisable to wait for and to seek immediate advice in terms of trying to correct it with simple lifestyle changes. And 80 to 85% of the abnormalities in the sperm parameters are caused by aberrations in the lifestyle changes. And if you are able to correct these lifestyle changes, it can get automatically your sperm count will improve naturally. So, if you are looking at more of sperm fertility issues, azoospermia, or any of the sperm parameters, you can get to on this helpline number of 7825850116, and we can you can book a call or an online consultation. I am available for offline consultation and a regular OPD clinic at Oasis Fertility, Vijayawada. Thank you very much for your time. Hope you like follow us for more such information.